In this video we'll briefly discuss what is ciprofloxacin, how it works, what it's used for, the dose and side effects, drug interactions, contraindications and precautions. Ciprofloxacin is a fluoroquinolone antibacterial. It inhibits DNA gyrase, thereby blocking bacterial DNA replication. Susceptible organisms in vivo include. It is available as 250, 500 and 750 mg tablets. And also available as injection, oral suspension, and ophthalmic solution. Ciprofloxacin is used for urinary tract infections, chronic bacterial prostatitis, urethral and cervical gonococcal infections, infectious diarrhea, anthrax and plague, typhoid fever, intra-abdominal infections, skin structure infections, acute sinusitis, lower respiratory tract infections, nosocomial pneumonia, and treatment of corneal ulcers and conjunctivitis, due to susceptible organisms. The usual dosage of ciprofloxacin, for adults is 500 to 750 mg orally, every 12 hours, or 400 mg intravenously every 12 hours. And for children the usual dose is 10 mg per kilogram, orally or intravenously every 12 hours. Do not administer to patients with history of allergy or tendinitis due to fluoroquinolone. Administer with caution to epileptic patients, because of risk of seizures. Reduce the dose by half, in patients with renal impairment. Ciprofloxacin may cause gastrointestinal disturbances, neurological disorders, such as headache, dizziness, confusion, hallucinations and seizures. Allergic reactions, peripheral neuropathy, photosensitivity, arthralgia, myalgia, tendon damage, QT interval prolongation, hypo or hyperglycemia, hemolytic anemia in patients with glucose 6-phosphate dehydrogenase deficiency. Avoid combination with drugs that prolong the QT interval. Monitor patients taking glibenclamide, because of risk of hypoglycemia. Do not administer simultaneously with antacids, aluminium or magnesium hydroxide, iron salts, or calcium. Administer 2 hours apart. Drugs that increase effects or toxicity of fluoroquinolones include. And drugs that decrease effects or toxicity of fluoroquinolones include. Fluoroquinolones increase effects or toxicity of oral anticoagulants, theophylline and caffeine. Advise patients to drink a lot